your future. Here's what's up in the rewarding field of healthcare.
If you like change, new technology, or helping others, consider becoming a respiratory therapist. From the intensive care unit to the rapid pace of the trauma room, every day is a new learning opportunity. You're a valuable resource and respected among physicians and other healthcare professionals. Respiratory therapy, check it out.
Your future, now on WTKR.com.
Brought to you in part by Bon Secours and Centera.
A respiratory therapist, put it in simple terms, what we do is we work in the critical care unit. And when a patient is sick, or if they're coming off surgery, we basically provide the ventilation the body needs. So we're acting as the lungs of the patient. There's many reasons why a person can be on a ventilator. One, it was very common, they might be post-surgical patient. So they were given paralytics during the surgery. So basically we're buying time where the body wakes up, where the medication has cleared the body, and allows time for the patient to wake up and breathe on their own. What motivates me to come into work every day is there's always a new scenario. It's not a stagnant job, it's pretty dynamic. There's always something new going on. A lot of the work is on your own. There's a lot of autonomy. You go out to the units on your own, and there's a lot of interaction with the physicians. Classes to prepare you to become a respiratory therapist in this field. The technology is constantly improving. Our ventilators these days is basically a computer board, circuit board, and that's the brains of it. So any classes that deal with computers, mathematics, or even your core sciences, because there's a lot of pathophysiology involved with these patients. If there's anatomy classes offered, if there's biology classes, physiology classes, I'd recommend that. Very minimum qualifications you need to be licensed as a registered respiratory therapist is you need an associate degree. And there's many community colleges that provide this degree program. One of the major benefits about being a respiratory therapist, there's always room for advancement, or if I needed to move out of the area, I can be employed in any state. If I wanted to branch off and say the ICUs, I was tired of the high pace, and I wanted to go into more of a diagnostic field like pulmonary function testing, more of a clinical 8 to 5 day period, because we're in the hospital. Basically our shifts are 12-hour shifts, 3 days a week, which is nice. But that's the good thing about healthcare. It's a 365-day business and 24 hours a day. Being in the healthcare field allows you to kind of set your schedule on how you want to live your life. It's really nice that way. This position or this field with healthcare is kind of tough sometimes because you do see loss. It all makes it worth the while when you come in and you work with a strong healthcare team.